Most of my working day is spent talking to families about how to stay healthy and treating relatively routine conditions like rashes and cold viruses. When you first learn to be a doctor, you use a systematic way to make a diagnosis. We ask questions, we examine a patient, we get all the clues, then we make a list of all the possible causes and we narrow that list down. But as a doctor becomes more experienced, we completely abandon that systematic approach for most patients, and instead, we move to a more efficient way to make a diagnosis, and that's through pattern recognition. For example, the disease you may have heard of, hand, foot, mouth, it has a lot of variations, but there are a few things that make it easy for us to recognize when a child has this illness. If the kid is at the right age and they have bumps on their palms or their soles, there's almost nothing else it can be. We can make the diagnosis, we can talk about treatment, and we don't spend that much time thinking about all the rare things, the scary things that the kid could have, like Rocky Mountain spotted fever, for example. Every so often, I see a patient who has symptoms that don't fit a pattern. That's when I get to be a diagnostician, like a doctor detective, and there's a mystery for me to solve. So, to celebrate Halloween, I'm going to share with you a few of the cases I've seen recently that were caused by common everyday things that we all encounter. Only in these cases, the patient had symptoms that showed up in the most atypical and the strangest ways. I'm Dr. Wendy Fishguts Hunter, and I'm the spooky pediatrician in the graveyard next door. I'm that mad scientist you call for unconventional advice about your kid's health. I mix the potions, poisons, and witchcraft of modern medicine with the terrifying reality of parenting. The first story I'm going to share with you is the boy who grew claws. Just last month, there was a full moon when a 5-year-old boy noticed that he had these new grayish-white patches at the base of one of his fingernails. He didn't think that much of it at first, until the patches started to appear on his other fingers, but not all of them. And then the patches started to appear on a few of his toes. He didn't say anything about them because at first he thought maybe he had done something to cause this weird color change. But then his nails started to peel and they would separate from the base of his cuticles. That's when he started to think about it a little bit more. He only noticed his nails peeling back when he got in bed at night. So he started to wonder if maybe, just maybe, he was turning into a werewolf. Were his parents hiding something from him? Were they werewolves too, but they didn't want him to know just yet? That's when he noticed that there were new nails growing in. Just faint, pink, baby new nails. Were these his grown-up nails? He had lost a few teeth and bigger teeth came in. Finally, he showed his mother the next day. 5 or 6 of his fingernails had mostly peeled off at the bases, and 3 or 4 of his toenails had as well. His mother asked how long this had been going on, and he thought about it and was like, well, maybe a few weeks. So she asked him why he hadn't said anything, and that's when he told her he thought he might be a monster, and he didn't want her to be scared. That was so thoughtful of you, son, she said. And then she took him to the doctor. Not a vet, a human doctor. You see, he was not turning into a werewolf. You grow hair first in that condition, not nails. What could this be, thought the doctor. It wasn't a nail fungus. His nails didn't have the bulky, gross look of a fungus. Could it be what doctors call pathologic grooming? No. In that condition, patients pull out every single fingernail as they obsessively pick at their skin or their nails. They don't just pull out a few nails, and they take out the entire nail. That's when the doctor thought to ask, have you been sick recently? And indeed, this 5-year-old had a rash and blisters in his mouth about 5 weeks earlier. His rash was on the palms and soles and on his butt. He had hand-foot-mouth disease, which is caused by a virus. It's a pretty rare condition, but kids can have something called onychomedesis, or nail shedding, 4 to 6 weeks after having hand-foot-mouth. And it truly is a mystery because nobody really knows why it happens. It's most likely because the virus inhibits the nail matrix from growing. Lucky for this kid, there's nothing you need to do about it, and new normal nails will grow back in after just a few weeks. Hand, foot, mouth is a very common condition caused by a group of viruses that also cause, scary things like diarrhea and fever, and sometimes vomiting too. But the characteristic symptom is a rash on the palms and soles and in the back of the mouth, and often on the butt as well. It's really common for a kid to get this around 18 months or 2 years of age, so this kid was a little older. And very rarely, the virus makes your nails stop growing. So the nails continue to grow out, but no new nail is created, so the nails start to shed off. It's really weird looking because it doesn't happen on every finger or every toe, and the nails themselves, they look healthy. They're just kind of disappearing. The scariest thing about hand, foot, mouth is that when a parent gets the disease, they feel horrific. Most parents tell me they're really surprised at how painful the bumps on the hands and the feet and the mouth are. They can be excruciating. So it's not such a bad thing if your child gets this disease when they're young. Most people are immune if they get it as a child. The next story I want to share with you is the boy who couldn't walk. This is the story of a healthy, active 9-year-old boy who woke up one morning and suddenly he couldn't use his calf muscles. He was totally fine everywhere else on his body and didn't have any pain unless he moved his ankles or tried to walk. It had started the night before when they were out late at another family's house for dinner. The family started to walk home, and that's when he said his legs felt tired and he asked to be carried. His parents thought maybe he was just tired from a busy day, so they picked him up and they carried him home and put him in bed. But when he woke up the next morning, he was much worse. His parents carried him into our clinic and laid him on the exam table. To me, everything looked normal, but his calves hurt. What was happening to him? He wanted to know. I sent him to the hospital to have his blood drawn, and it showed that his muscles were breaking down. There's one particular marker in the blood that's called creatine kinase, and it's released when muscle cells are damaged, and his level was very high. What could cause a kid to suddenly break down their muscles? There are lots of causes like drugs, toxins, and extreme overuse of the muscles. And there are, of course, some genetic and autoimmune diseases, big mystery things. And then there's viruses. And of course, this was a virus. He had had a very, very mild cold, barely any symptoms at all, about a week earlier. There are a few common childhood viruses that can cause muscle breakdown in some kids. We don't always know why the muscles are attacked. Sometimes the virus goes right into the muscle and damages the cells. For example, Coxsackie virus can do this, if you've ever heard of that. Sometimes the child's own immune system gets overactive in response to the virus infection in the body, and the process of targeting viral infected cells, it inadvertently attacks the muscle cells. And some viruses, they actually make toxins that harm the muscle cells directly. This patient's calves, they hurt so bad, so the mom treated his pain with medicine. But the scary thing in this case is not the muscle problem. It's actually the kidneys you need to worry about. When the muscle cells are damaged, they release something called myoglobin, which you can see in the urine. It turns urine brown, so it looks like tea or Coca-Cola. I've seen this happen in a kid who suddenly was lifting weights very excessively. He broke down so much of his muscle that his urine turned brown. Myoglobin can get stuck in the kidney and injure it. So what's the treatment? You have to flush out the myoglobin. So you have to drink just an excessive amount of fluids. Usually we use intravenous fluids. So I talked about the options with the mother. I told her he needs to drink a lot. And I emphasized that. And you know what she said to me? She stopped me and she said, "I'm German. I can make him drink." She kept him home. We rechecked his labs every day. And she actually got him to drink enough that he didn't have to go to the hospital. This is the case of the shrinking baby. A beautiful new baby was born to a lovely couple who were visiting from another country. They came to the United States because they wanted a child so badly, and they were able to find a wonderful surrogate mother to carry their child, which unfortunately is illegal in the country where they live. This caring couple, they did everything to prepare for the arrival of this most anticipated, wonderful addition to their family. They bought all the best products. They even brought formula from their country because they knew they would be returning and they didn't want to change the baby's formula. The first day I saw the baby, he was just 2 days old, healthy as a baby could be, plump and content. He had lost just a little bit of weight since birth, but that's really common in babies. They're born with lots of extra fluids, and they lose that in the first few days. So I asked the family to come back to clinic in just a few more days so we could check his weight. Everything seemed just normal. 4 days later, I saw the baby again, and he was still losing weight, which is worrisome in a baby who's getting formula. You see, breastfed babies, they can lose weight while they're waiting for their mom's milk to come in. For some moms, their milk comes in right away, but for other moms, especially ones who have a difficult, stressful delivery, their milk can be delayed. But that couldn't be the case here because he was drinking formula. If a baby doesn't gain weight, we worry there's something wrong. We may not know exactly what's wrong, but a baby who gains weight, well, that means they're using all their calories to grow. So if a baby is not gaining weight but is eating plenty, we worry their calories are being used up by something else because they have something wrong with their heart, their lungs, their kidney, or their liver. This baby looked fine, but he wasn't gaining weight. I went over the feeding schedule again. Was he feeding at night? Yes, they were feeding him every 3 hours around the clock. How much was he eating? Well, he was eating at least 2 ounces, sometimes 4 at a time. Was he spitting up? No, he wasn't losing his calories that way either. He was peeing and pooping just fine, they told me. Did he seem really hungry? No, not particularly. He fed great. He cried to feed every 2.5 or 3 hours, just like he should. All right, what about how they're mixing the formula? Were they using the right ratio? Yes, they assured me. They were mixing the formula just perfectly. I had seen babies before who were not gaining weight. One even started having seizures, and it was because the parents didn't have enough money to buy formula, so they were mixing the formula with extra water to make it last longer. But babies can't handle this because their kidneys are not mature enough to get rid of extra water yet, so their blood becomes diluted. Their relative sodium concentration in the blood goes down, and this leads to seizures. That's why you should never give extra water to a baby until they're older than 6 months when their kidneys start to work. So I gave it a few more days. I asked the parents to come back 2 days later. And when they did, we had our answer. The parents went home and realized they actually weren't mixing the formula correctly. They bought a machine to mix the formula. It's like an automatic coffee maker for formula. They discovered that the machine had a setting for American formula and one for international formula that they weren't aware of. They checked their formula can and realized they were supposed to mix 1 ounce formula with 1 ounce water, but the machine mixes 2 ounces water with every 1 ounce powder. The baby was getting half as much formula as they thought they were giving. I sent the baby to the laboratory to get his electrolytes checked, and everything was just fine. The baby started gaining weight well, and soon after, they returned home with their healthy baby. It's really scary for a parent to have a baby that's not gaining weight, and pediatricians are scared too because they know all the bad reasons that babies might not gain weight. This is one of my favorite stories because everything worked out fine, but also because the thing that's really scary in this story is corporate America. Beware baby product companies that are just trying to make money. You do not need most of the gadgets that are marketed to you. I want to share the heartwarming part of this story too. When the couple returned to their home country, they donated all of their baby supplies, their crib, bassinet, blankets, extra diapers, and all their baby clothes to a shelter for homeless mothers, and they threw away the baby bottle maker. I have one last quick story for you. Let's see if you can solve the mystery before I reveal the answer. It's the case of the haunted hearing. A 9-year-old boy came into our clinic soon after lunch just a few months ago. He had always been a very frail, extremely thin and pale child. His mother had brought him in and his siblings to our clinic very often for a number of years because they had a variety of very strange symptoms, like rashes and coughs. And every time I saw the children, I couldn't see or hear any of the symptoms their mom was worried about. At some point over the past 2 or 3 years, the mother had discovered black mold in the walls of their house. It was dripping. No, it wasn't dripping. It was just in the closets. And she was concerned that this was the cause of her children's symptoms. So she stopped bringing her kids to our clinic and she started to see an alternative practitioner. So we hadn't seen this child in at least over a year when he came in that day a few months ago. His mother brought him in because for about 2 weeks, he was increasingly having auditory hallucinations. He was hearing things that other people weren't. The mom wasn't particularly worried about it at first because she thought maybe it was his imagination, but the voices he was hearing became more prominent and were clearly distracting him, and he started to act very oddly at home. She had trusted us with her children's care in the past, so she brought him in because she thought we could help with this as well. The thing is that true hallucinations are extremely rare in a child this young. This really could not be a psychiatric condition like schizophrenia at this age. The most common cause are really bad things like seizures, maybe migraines, brain tumors, or toxins. However, when you talk to this kid, he could very accurately describe what truly did sound like auditory hallucinations. He was hearing them all day and all night. We asked if he was taking any new medications, and the mom said he was not. Was he having headaches? That could indicate a migraine or a brain tumor, but he wasn't having headaches either. How was his appetite? Not really different. It might even have been increased, as a matter of fact. So, of course, we doctors always think of the scary things first, and we were worried the child could have a brain tumor. That could be a likely cause. This was not something that could wait, so we asked her to go directly to the emergency department at our children's hospital, which she did. So the patient went to the emergency room and they did several tests. They did kind of what we call a shotgun approach. When we don't really know what we're looking for, we just kind of order everything and see if something shows up. And what showed up? The ER ordered a toxicology screen, and he tested positive for THC, the active ingredient in marijuana. And when the doctors told the mother, she said that yes. In fact, she had been giving him a CBD gummy every night because she thought it would protect and heal him from the black mold in their house. She swore it didn't have any THC in it. But unbeknownst to her, wherever she was buying the gummies, they were not regulated or tested, and she was giving him THC every night for the past 6 weeks. THC is the primary psychoactive component in cannabis. Adults mostly just have euphoria or relaxation, but children can have a very different type of reaction. Obviously, a child's smaller size means that a small dose might be more potent in their little body, but also the blood-brain barrier, that's the system in the body that protects substances from entering the brain, is less developed in kids, and drugs might have a more pronounced effect on a child's nervous system. The other thing is that the endocannabinoid system that THC works on can lead to abnormal brain signaling and can lead to hallucinations in children because that system is still developing. His older sister was also taking the gummies every night, but she wasn't having the same effect. We don't really know why he was affected, and it probably was just because of his young age. So this mother basically accidentally poisoned her child. It was a very surprising answer to us, but the truth is that this was the most benign, least scary of any of the possible causes of his auditory hallucinations. Here's the truth. We worry about things that will never happen to us. And the truly scary things are the things that are right in front of us that we don't even know, like advertisements for products that we don't even need, and cold viruses, and even our own parents. For more from the Pediatrician Next Door, find me on the web at pediatriciannextdoorpodcast.com. If you've got a spooky question about the creepy things that kids do, send an email to hello@pediatriciannextdoorpodcast.com for a chance to hear your voice on the show. I'm Dr. Wendy Hunter, and I'm the pediatrician next door. This show is produced by Red Rock Music. Make sure to subscribe and leave a review wherever it is you're listening. I'll be back next time with more.